All right, we're about to take a guided tour deep inside the human heart, one of the most complex and obviously most vital organs in our body. And our window for this journey? It's a truly remarkable technology called cardiac MRI. But first, let's start with a really fundamental question. Just think about it for a second. The heart never stops moving. It beats something like 100,000 times a day. So trying to get a sharp, detailed picture of it is like trying to photograph a hummingbird's wings in mid-flight. So how on earth do doctors pull that off? Well, they do it with this. This is a cardiac magnetic resonance image, or cardiac MRI for short. It's a super specialized technique that can, believe it or not, essentially freeze the heart's motion in time. And that gives us this unbelievably clear and detailed view inside the body's engine room. Okay, but getting the picture? That's just the first step. To really understand what you're seeing, you have to know how to look. So let's start our tour there, with a radiologist's first look, and learn how they see what's really going on. You see, one single type of image just isn't going to tell you the whole story. Imagine trying to understand a house if all you had was the floor plan. Sure, you'd see the rooms, but you'd have no idea where the pipes run. To really know what's going on, doctors need both the blueprint and the plumbing map. And this is a brilliant illustration of that idea. On the left, we've got a dark blood image. By making the blood appear black, it gives doctors a crystal clear outline of the heart muscle and the chambers. That's our blueprint. Then on the right, you see a bright blood image. Now the blood shows up white, which is absolutely perfect for seeing how it's moving and flowing. And that's our plumbing map. Okay, let's go to our next stop and see how all this builds. We're going inside the heart's 4 main chambers. You know, the engine rooms that power our entire body. So when a radiologist first looks at these chambers, their first goal is actually pretty straightforward. It's just a general assessment. They're asking, are these rooms the right size? Are they proportional to each other? Is anything misshapen? It's really just a fundamental check of the heart's basic architecture. Now, how do they know what's normal? Well, it's not just a guess. They use established measurements and ratios. For instance, the right ventricle should usually be smaller than the left, so their ratio needs to be less than 1. The atria, the upper chambers, also have typical size limits. This table just gives us a simplified peek at the kind of numbers they're checking against. And this is where it gets really crucial. This is what happens when you compare a scan to those normal values. On the left, you see a heart with perfectly proportioned chambers. But now, look at the image on the right. I mean, you don't need to be a doctor to see the dramatic difference here. The chambers are clearly dilated or enlarged. They look stretched out and totally misshapen. And that one visual comparison is just so powerful. This isn't some minor detail. This is often the very first major clue to diagnosing some really serious conditions. An enlarged chamber could mean the heart muscle has weakened and is struggling to pump, a sign of heart failure. Or maybe a valve is leaky, causing blood to back up and stretch the chamber wall. Okay, so we've seen the inside. Now let's step outside for a minute and check on the heart's protective armor. We're talking about a structure called the pericardium. So what is it? The pericardium is this thin but surprisingly tough sac that encloses the entire heart. Its job is to protect the heart, anchor it in place inside your chest, and prevent it from overfilling with blood. It's really the heart's own personal suit of armor. On an MRI, a healthy pericardium has some very specific tells. Doctors are looking for a thin, smooth line around the heart muscle. It should be less than 4 millimeters thick, and, this is critical, it shouldn't enhance, which is really just a fancy way of saying it shouldn't light up after the patient is given a special contrast dye. And here is a perfect example. If you look really closely, you can see that fine, dark, almost pencil-thin line tracing the outside of the heart muscle. That's a normal, healthy pericardium doing its job just right. Any thickening of that line, or if it lit up with dye, that would be an immediate red flag. It could signal inflammation, a condition called pericarditis, or even more serious issues where that armor gets too thick and starts to constrict the heart. So we've toured the chambers and we've checked the armor. Let's pull back and just talk about why this single, clear picture is so revolutionary in medicine. When it really comes down to it, the message is simple, but it's also profound. A clear picture is the first and most critical step toward a clear diagnosis. Without the ability to see things this clearly, doctors are just working with incomplete information. You know, what we've just done here is basically follow the exact logical process a doctor uses.
They start by solving that incredible technical challenge of imaging a moving heart. Then they use those different blueprint and plumbing views to assess both the structure and the function. They compare what they see to the normal values, and from there they can pinpoint the abnormalities that tell them what's wrong.
And this isn't just me oversimplifying it. As our source material from the journal Radiographics puts it, this whole process covers the 4 basic pillars of a cardiac MRI. We've talked about anatomy, the structure, and function, how it's working, but it also lets doctors assess the heart tissue itself to see if it's healthy or scarred, and the hemodynamics, which is just a technical term for how blood flows through the chambers and vessels. It's the whole shebang. It truly is a window into the heart. And it leaves us with a fascinating final thought, doesn't it? If this is the level of detail we can achieve today, allowing us to diagnose disease with such incredible precision, what will the medical images of tomorrow reveal? What new windows are we going to open up next?